Hello everyone. In this session, we are going to cover a very important topic, that is autoimmune hemolytic anemia, also known as AIHA. You usually get a long question as well as short question on this topic. This topic is difficult to understand, but I will make very clear, crystal clear, super simplified for you. But please concentrate. So let's start the topic. Autoimmune hemolytic anemia. Here you can see we are starting it. Autoimmune hemolytic anemia, also known as AIHA AHA. So autoimmune hemolytic anemia. First of all, I will let you know the introduction. What do you mean by autoimmune hemolytic anemia? Then we will see its two types: the warm autoimmune hemolytic anemia and the cold autoimmune hemolytic anemia. The most important is the pathogenesis and causes of each type. So you must understand what is the difference between the two types, what is the pathogenesis of the two types, what are the causes of the two types with their diagram, and finally overall lab diagnosis. So let's start it. Before understanding the topic, you must understand how the RBCs are synthesized and they are destroyed normally in a healthy adult human being. We know all the blood cells are formed in the bone marrow. Can you see this is a bone marrow? So RBC is also a blood cell. In the blood, we are having three cells: RBC, WBC, platelet. They all are synthesized in the bone marrow, including RBC. So RBC is synthesized in the bone marrow. You can see the sequence. So first cell which gives rise to the RBC is hematopoietic stem cell. Hematopoietic stem cell give rise to myeloblast. It gives rise to pronormoblast, early normoblast, intermediate normoblast, late normoblast, retic, and finally RBC. Once the RBC is formed, it will come in the blood. It will come in the blood. It will remain in the blood for 120 days. The lifespan of a normal RBC, healthy RBC, is 120 days plus minus 30 days. After 120 days, this RBC will move to the spleen. So inside the spleen, it will move inside the macrophage of the spleen. This is the macrophage of the spleen known as RE system. This is known as reticuloendothelial system, RE system. So this RBC will move inside the macrophage of the spleen and get destroyed there. So this is how RBC get destroyed after 120 days. So this is the complete story in front of you. So RBCs are usually destroyed after 120 days. So this is normal. So they are formed in the bone marrow. RBCs are formed in the bone marrow and they are destroyed in RE system. This is normal and they remain in the blood for 120 days. So RBCs are formed in the bone marrow. They are destroyed in RE system after 120 days and they remain in the blood for 120 days. This is normal for a healthy adult RBC. Now, if you understood this, you will be able to understand the topic autoimmune hemolytic anemia. Now, what are antibodies? When the body will form the antibody? So antibody is a part of immunity. You can say it's like army. So whenever any terrorist enter human body, the army get activated and army will fight with the terrorist and kill the terrorist, attack the terrorist. So who's the terrorist? The terrorist is the foreign particle. So whenever any foreign particle comes in our body, the body immunity will get activated and our body will form antibodies against the foreign particle. These antibodies attack the foreign particle and kill the foreign particle like a terrorist. So the antibodies are like the army. So we are supposed that army should activate it only when the terrorist is coming. Otherwise, army should not be get activated. But here I am telling you the body is forming antibodies which are autoantibodies. So here the body is forming the antibodies against the human own cell. The human own cell. Ideally, the antibodies should kill and attack the foreign cells. But here the antibodies are killing body's own cell. That is autoantibody. Which cell? RBC. So body is forming autoantibodies against the RBC antigen. So you can see this is the RBC present in the blood. Can you see the RBC in the blood? Now RBC have the antigen on its surface. So the body is forming antibodies against the antigen of the RBC. RBC is the own cell. So as soon as RBC is formed in the marrow, it is coming in the blood. So as soon as it comes in the blood already autoantibodies are present. These autoantibodies will bind with the antigen present on the surface of RBC and destroy them, kill them. So before 120 days only, the RBC get destroyed in the blood. RBC get destroyed in the blood before 120 days. That is autoimmune hemolytic anemia, AIHA. Why it is known as AIHA? Autoimmune, because here autoantibodies are formed. It's autoimmune hemolytic anemia. Now it is of two types. What do you mean by two types? Warm and cold. What do you mean by warm and cold? So in both of them, the warm as well as cold. Warm AIHA, cold AIHA. The autoantibodies are there in both of them. So let me draw the autoantibodies here also. So autoantibodies are present in the blood here also. Autoantibodies are present in the blood here also. The autoantibodies against the RBC. But the point is that when these autoantibodies are reacting with the RBC, when these autoantibodies will react with the antigen present on the surface of the RBC, at what temperature they react, I mean. So whenever these antibodies are reacting at human body temperature, that is at 37 degree, it is known as warm AIHA. And when these autoantibodies are react at 4 degree, 0 to 4 degrees Celsius, it is known as cold AIHA. So in warm AIHA, the autoantibodies once formed, they will come and react with the antigen because the human body temperature is 37 only. But in cold one, they remain in the blood only. They will not react. They remain in the blood, but they will not react. They will react when the